This is Dr. Robert Kozer. I am a chiropractic physician here at Laser Spine Institute. So today I have the pleasure of introducing and speaking with Dr. Eric Rodeke, our Vice President of Business Development. So thanks for joining us today, Eric.
Thank you. Good to be here.
Perfect. So something that I'd like to get started with is talking about something really exciting going on with Laser Spine Institute. So as we know, patients that have surgery here are twice as likely to report positive outcomes versus other patients that have had surgery in other surgical practices. So with that said, I think this is something that is really great to report, and we need to talk about, what is value-based care, what does that mean, and how does that tie into business development here at Laser Spine Institute?
Sure. So with that kind of a statement and value, if you will, that we're delivering to patients, when you talk value-based care, really in the most simplest form, how do patients get the most value out of their healthcare dollars that they're spending? Mm-hmm. And they do that when partnerships are formed in the clinical basis with other providers, with chiropractors, with physical therapists, with interventional pain management doctors, and with that being said, then everybody gets to now collaborate and talk, just as we're talking here, mm-hmm. about what's best for this patient.
Patient-centric care.
Patient-centric care, and that includes even on the employer side, working with the employers mm-hmm. to also help them to understand how to help their employees to be more productive in a cost-effective manner. Mm-hmm. Healthcare is so fragmented as it is. You go to your primary care physician, you might tell them that you're in pain, they might prescribe some non-steroidal anti-inflammatories to you and muscle relaxers and maybe send you to physical therapy. But then if the pain doesn't go away, then what happens next? Then they might send you to an orthopedic surgeon and so on and so forth. Well, by having that true collaborative care that Laser Spine Institute has set up with communicating with other providers throughout the country, combined with the research that they do, mm-hmm. it's the best recipe for the best type of care that's out there within the spine care space.
Right, and here on site too, there are numerous types of practitioners. We have orthopedic spine surgeons, neurosurgeons, nurse practitioners, chiropractic physicians, physical therapists, all working together for the patient.
Yes.
Absolutely.
Yes.
Absolutely. So can you talk to us a little bit about what is the vision of Laser Spine Institute? What is the mission as far as how that ties into business development?
Sure. So, the name by itself, laser spine surgery, really, there's much more to it than that. We now have a complete mission of delivering spine care services to patients. And what that includes is conservative care. That includes exhausting all conservative treatment options that we can make available to patients, not only with us here, but with our preferred provider network, mm-hmm. and having to benchmark and track their progress over time to see if they may need surgery in the future. Not everybody is a surgical candidate. In mm-hmm. fact, we do less surgery on patients here than compared to the total amount of patients that even see us. So we really help to guide patients along their journey to make sure that they have the appropriate conservative care treatment that's made available to them, and that they exhaust that, and that if and when they do need surgery in the future, that's when we would go ahead and help them with that kind of path in their life.
Gotcha. Perfect. So as far as research goes, how do you think with what we're doing here at Laser Spine Institute ties into the insurance network and payers and so forth?
Yeah, so that's really what attracted me here at LSI. It's people like Dr. Davis and looking at him and one of the head neurosurgeons, world-class neurosurgeons, really, in my opinion, in the world. I mean, he is one of the leaders in minimally invasive spine care research in the world, and that enables us to really have a competitive advantage with our other competitors that mention laser spine surgery. Well, we do very little of laser spine surgery here. We do muscle-sparing techniques to avoid cutting unnecessary tissues compared to competitors that mention laser spine surgery when in fact we just use muscle sparing techniques to help the surgeons make a correction to the spine in the most minimally invasive way, really, and that's what gives us the advantage. And because we do our own research here, in fact, we lead this field in minimally invasive spine surgery research, where other competitors cite our research for spine centers of excellence. So I really believe that we're setting the bar a lot higher for spine centers of excellence with our research and with our outcomes. What does that mean to patients? That means that we have more predictable outcomes and we're willing to show what they are in a research format that's transparent to the entire world.
Mm-hmm.
And that's a big deal. And that also helps us out with the payers, with the insurance companies, because we now can show them our research, how patients are doing better. If you look at some of our research with our return to work studies that we have, 1.3 months, 100% return to work with our military study. I mean, that's research that's kind of unheard of. Mm-hmm. And getting out there to the payers and the employers, that shows that their people can now get much more productive in the workplace and back to work sooner, with costing much less money, along with the payers not having to deal with these more catastrophic claims that are out there related to spine care.
Gotcha. Well, Dr. Grodke, thank you very much for joining us today. Feel free to check out our website, laserspineinstitute.com/results, to learn more about what we have discussed here today. And thank you for joining us.